Thank you, Manju ma'am, and thank you, Iqbal sir, for giving us this opportunity. Ladies and gentlemen, a very warm hello. Today, me and my team will be presenting on the Sustainable Developmental Goal 3, Good Health and Well-being. So, let's take a look at what we have on the agenda for today. First, we'll define what good health and well-being is. Then we'll take a look at why we chose this topic. Then we'll explore the different types of good health. We'll see the history of sustainable developmental goals. We'll see the targets that were set by them and the current scenario, the progress of those targets. We'll also add a few suggestions from our part. And last, we'll conclude. So first, why did we choose this topic? 14-year-old Faiza Ansari wanted to be an engineer. Instead, she died this month from leukemia, failed by an overloaded and often heartless healthcare system. From the day Faiza Ansari was diagnosed with leukemia, her life followed a tragic arc. Turned away by hospitals, her sobbing pleas ignored, her parents desperately trying to find a bed for her. If beds aren't available, what must poor patients do? Die? These were Faiza's last words, captured on a video taken by her father to gain some attention. The images of the frail and wild-eyed teenager, who by now was bleeding from her nose and ears, finally reached the top government hospital in the Indian capital, Delhi, where she was belatedly admitted on 5 December. Faiza died a few hours later. Her story captures the experience of far too many poor Indians failed by a healthcare system that is free but overloaded and inefficient. More than 6 million children die before they see their 5th birthday each year. We chose Sustainable Developmental Goal 3, Good Health and Well-being, because health transcends borders and affects every individual, regardless of nationality, socioeconomic status, or background, making it a universally pertinent issue. Access to healthcare is a fundamental human right. Ensuring healthy lives and promoting well-being is not just a moral duty, but a cornerstone for stability and prosperity. Now, let's define what good health is. According to the WHO, health is a state of complete physical, mental, and social well-being, not merely the absence of disease and infirmity. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, or social condition. The health of all people is fundamental to attaining peace and security, and it is dependent on the fullest cooperation of individuals and states. Now, let me hand over the mic to Darshini to explore on different types of good health.
Now let us explore the various types of good health. Mental well-being relates to the ability to manage stress, emotions, and relationships effectively, cultivating resilience and seeking support when needed. Physical health refers to the condition of your body and its systems. It involves maintaining a balanced diet, regular exercise, adequate sleep, and the absence of disease or injury. Emotional health focuses on managing and understanding your emotions and entails understanding and expressing feelings constructively. Social well-being involves nurturing meaningful and positive relationships and interacting within your communities, as well as contributing to one society. Thus, achieving overall well-being requires a holistic approach where these dimensions interact positively to support a fulfilling life. Now let us take a look at the history of SDGs or Sustainable Development Goals. The Sustainable Development Goals (SDGs) were adopted by the United Nations in 2015 as a universal call to action to end poverty, protect the planet, and ensure that by 2030, all people enjoy peace and prosperity. Prior to 2015, there existed Millennium Development Goals or MDGs, a precursor to the present SDGs. The global maternal mortality ratio in 2015 was estimated at 216 maternal deaths per 100,000 live births, and the global under 5 mortality rate was 37 deaths per 1,000 live births. Non-communicable diseases cost approximately 71% of all global deaths in 2015. As a result, post-2015 goals were established at the Rio Plus 20 summit in 2012. It was officially launched on the 1st of January 2016. The official wording of SDG 3 is to ensure healthy lives and promote well-being for all at all ages. Now moving on, let us take a look at the targets of the Sustainable Development Goals. The first target, target 3.1, is reducing maternal mortality. The aim of this target is to reduce the global maternal mortality rate to less than 70 per 100,000 live births by 2030. The data for these targets are collected on the basis of certain indicators. The indicators for this target include maternal mortality ratio and proportion of births attended by skilled health personnel. There is a remarkable progress in reducing maternal mortality from 362 to 164 deaths per 100,000 by 2017. However, the global target is less than 70 deaths per 100,000 live births, and the national target is lesser than that, which is 140 deaths per 100,000 births. Ensuring safe childbirth isn't just a matter of healthcare, it's a matter of human rights and sustainable development. So, how do we achieve this goal? One of the most effective strategies is providing skilled care during childbirth. Family planning and access to medicines is also crucial. Each mother should be aware of the do's and don'ts in childcare and pregnancy. Thus, this isn't merely an investment in reducing maternal deaths, it's a triple investment. How? Skilled care not only reduces maternal mortality, but also lowers newborn deaths and stillbirths. It's a topic that affects not just individual families, but the entire fabric of our society and future generations. Moving on to the second target, target 3.2. 6,700 neonatal deaths occur every day. The target 3.2 ensures ending all preventable deaths under 5 years of age. Its aim is to reduce neonatal mortality to at least as low as 12 per 1,000 live births and reduce the under 5 mortality to at least as low as 25 per 1,000 live births by 2030. The indicators for this target are under 5 mortality rate and the neonatal mortality rate. Globally, 2.4 million children died in the first month of life in 2019. However, there is commendable progress. In 2019, the under 5 mortality rate was lower than the SDG target of 25 deaths per 1,000 live births. Let's take a look at the third target, target 3.3, fighting communicable diseases. Its aim is to end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases and combat hepatitis, waterborne diseases, and other communicable diseases by 2030. The indicators for this target are number of new HIV infections per 1,000 uninfected population, tuberculosis incidence per 100,000 population, malaria incidence per 1,000 population, hepatitis B incidence per 100,000 population, and number of people requiring interventions against neglected tropical diseases. This target has, however, faced several setbacks, leading to an alarming 45% increase in new infections of HIV/AIDS. A very slow annual decline in incidence of TB was observed. In the case of malaria, since 2015, 3 countries, Egypt, Iran, and Oman, have reported 0 indigenous cases of malaria and have expressed an interest in certification of malaria-free status. Although overall deaths from hepatitis are increasing, new infections of HBV are falling thanks to increased coverage of HPV vaccination among children. Neglected tropical diseases are a major public health problem, with at least one such disease prevalent in all countries. Now I'd like to hand over to Gopika to elaborate on the other targets.
Moving on to target 3.4. By 2030, reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment and promote mental health and well-being. Every 2 seconds, someone aged 30 to 70 dies prematurely from NCDs, which include cardiovascular disease, cancer, diabetes, and chronic respiratory disease. By 2030, the aim is to reduce premature mortality from non-communicable diseases by 1/3 through prevention, treatment, while also promoting mental health and well-being. Despite efforts, there have been negligible changes in the probability of dying between ages 30 and 70 from these 4 main NCDs. Chronic diseases require longer reporting periods to show significant changes. Mental health is equally crucial. One important indicator is the suicide mortality rate. In India, the situation is particularly alarming, with 1.2 students committing suicide every day. Reducing premature mortality from NCDs and promoting mental health is not just about saving lives. It's about improving the quality of lives. Moving on to the next target, target 3.5, strengthening the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol, is critical for global health. From 2010 to 2018, global alcohol consumption remained below 4 liters of pure alcohol per capita, with 25.5% of this being unrecorded alcohol. The criminalization of drug use and possession in some countries creates barriers to these life-saving services, deterring people from seeking help and increasing the risk of blood-borne diseases and death by overdose. Addressing these concerns requires compassionate, evidence-based policies and expanded access to harm reduction services to save lives and improve health outcomes. Moving on to the next target, target 3.6, reducing road injuries and deaths. More than 2 deaths occur every minute due to road accidents. By 2020, half the number of global deaths and injuries from road traffic incidents. Globally, the median death rate from road traffic injuries declined slightly from 24.7 per 100,000 population in 2010 to 24.0 in 2016, following the implementation of the Sustainable Development Goals. In Sweden, for example, efforts to improve road safety have resulted in a 66% reduction in road fatalities. This achievement demonstrates that with the right policies and commitment, we can save lives and prevent injuries. The leading cause of death have shifted from communicable diseases to non-communicable diseases, NCDs, with road injuries being the only injury-related cause among the top 10. Now, I invite Fatima to tell us more about the remaining targets.
Target 3.7 is about granting universal access to sexual and reproductive care, family planning, and education. By 2030, it aims to ensure universal access to sexual and reproductive healthcare services, including family planning, information and education, and the integration of reproductive health into national strategies and programs. The data for this target is collected through the indicators like the proportion of women of reproductive age 15 to 49 years who have their need for family planning satisfied with modern methods of contraception, adolescent birth rates aged 10 to 14 years per 1,000 women in that age group. There were negligible changes in adolescent fertility and women who are satisfied with modern contraceptive methods. This highlights the need for the upscaling of investments pertaining to reproductive health and education. Target 3.8 is about achieving universal health coverage. Its aim is to achieve universal health coverage, including financial risk protection and the access to quality essential healthcare services. Its indicators include the coverage of essential health services and the proportion of population with large household expenditures on health as a share of total household expenditure or income. The UHC includes migrants and refugees, even if they do not have any legal status. There were modest improvements in the UHC service coverage index in most countries of the world between 2015 and 2017 through strengthened health information systems. Target 3.9 is about reducing illnesses and deaths from hazardous chemicals and pollutions. By 2030, it aims to substantially reduce the number of deaths and illnesses from hazardous chemicals and environmental pollution. The data that provides details on progress is obtained from the mortality rate attributed to air pollution and the mortality rate attributed to unsafe water, unsafe sanitation, and lack of hygiene. Household air pollution is estimated to cause half of all pneumonia deaths among children under the age of 5. We can also see how the air pollution mortality rate has increased from 31.6 deaths per 100,000 population in 2012 to 41.5 deaths per 100,000 population in 2016, emphasizing the need for going green and conserving the environment. Now, I invite Ishan to speak about the implementation of these targets.
We have taken a look at the targets. Now let's see how to implement those. First, we have strengthening the implementation of the WHO Framework Convention on Tobacco Control in all countries as appropriate. Then, we'll have to see of supporting the research and development of vaccines and medicines for communicable and non-communicable diseases that primarily affect developing countries and provide access to affordable essential medicines and vaccines. Next, we must also substantially increase health financing and the recruitment, development, training, and retention of health workforce in developing countries, especially in the least developed countries and small island developing states. Next, we must strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction, and management of national and global health risks. Now, let me call upon Gopika to expand on the diseases ravaging the state.
Drawing your attention to a grave concern impacting the state of Kerala. Kerala has been a battleground against the deadly Nipah virus, with 3 out of the 4 outbreaks occurring in the Kozhikode district. Even though bats with Nipah antigen was found in other states, no cases were reported, implying that other states may remain unaware, highlighting the vigilance and robust health surveillance in Kerala. Adding to this distress is the emergence of another rare but lethal threat, primary amoebic meningoencephalitis or PAM. In just the past 2 months, Kerala has reported 4 cases, resulting in 3 tragic deaths. This rare brain infection caused by amoebic contamination underscores the relentless threats faced by the state's health system. These outbreaks and infections are not mere numbers, they represent human lives. Next, I invite Fatima to tell us more about the various health schemes.
Existing government health schemes in India aim to improve public health infrastructure, ensuring universal health coverage and addressing prevalent health challenges effectively, thereby promoting better health outcomes for all citizens. First, we have the Janani Shishu Suraksha Karyakram, which was launched on 1st of June 2011. It entitles all pregnant women delivering in public health institutions to absolutely free and no expense delivery, including cesarean section. In a transformative stride forward and in order to prevent and control the major non-communicable diseases, India has introduced the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke, otherwise known as the NPCDCS. It focuses on strengthening infrastructure, human resource development, health promotion, early diagnosis, management, and referral. The Electronic Vaccine Intelligence Network, or EVIN rollout, is another scheme that has been implemented by the Government of India. It digitizes the entire vaccine stock management, their logistics, and temperature tracking at all levels of vaccine storage from national to sub-district. The National AIDS Control Program, or the NACP, is another scheme which was launched in 1992 and is being implemented as a comprehensive program for prevention and control of HIV/AIDS in India with an objective of slowing down the spread of HIV infections so as to reduce morbidity, mortality, and the impact of AIDS in the country. Coming up, we have the Pulse Polio Immunization Program, which was launched in India in 1995. It is conducted twice each year. In these campaigns, children of age 0 to 5 years are administered polio drops. Each year, over 247 million children are immunized during each such campaigns. Another much needed and significant scheme launched by the government in 1982 is the National Mental Health Program. It was launched keeping in view the heavy burden of mental illness in the community and the absolute inadequacy of mental health care infrastructure in the country to deal with it. Now, let us look at how non-governmental organizations play a crucial role in promoting healthcare. First, let us take a look at Doctors Without Borders.
It was launched in 1971 and was founded to save lives and to speak out. It is a charity that provides humanitarian medical care. It is of French origin, known for its projects in conflict zones like Palestine and Syria, and in countries affected by endemic diseases. In New Delhi, they run a clinic for victims of sexual and gender based violence, offering round the clock care. Next, we have the International Committee of the Red Cross, which aims at protecting and assisting victims of armed conflict and promoting understanding and respecting for international humanitarian law. Another NGO is the Future Health Africa, which is a UK based charity. It strives for sustainable improvement in the health and well being of people in the low middle income countries. Last but not the least, we have the Nitya Foundation, which is an NGO based in Delhi whose core focus is on child development, women empowerment, education for poor, and the general well being of citizens. NGOs are a necessary component of the healthcare machine and integral proponents of universal healthcare access. It is with the integration of schemes of the government and the NGOs that we can ensure each child lives to realize his or her potential. Now, I invite Darshini to talk about the threats faced by the healthcare system.
Even though there has been a considerable improvement in the standard of healthcare globally, certain setbacks have kept us from realizing our goals. Let me indulge in a few of them. Firstly, let us talk about the COVID-19 pandemic, a serious threat to the progress of SDD3. As the pandemic spread worldwide, the lockdown had over 70 countries putting a hold on various health services such as child vaccination, family planning, and cancer screening. Unfortunately, this significantly reversed decades of improvement and has reiterated the need for governments to prioritize issues of healthy living and well-being and work towards the goal of SDG3. Another challenge we face is the lack of technological integration. Managing and in maintaining and integrating new technologies such as electronic health records and telemedicine while maintaining data security and privacy is integral for the efficient functioning of the healthcare system. However, most government facilities are unable to fulfill the requirements, leading to inefficiency in healthcare. Another significant issue we face is the fact that the common people are the ones that suffer the most due to urban rural disparities. Healthcare services are often concentrated in urban areas, leaving rural populations to face challenges in accessing timely and appropriate healthcare. We also face a shortage in healthcare financing. Limited public spending on healthcare results in out of pocket expenditures, pushing many families into poverty. We must tackle these issues to ensure that no person has to face the trials and tribulations of an inefficient healthcare department. Moving on, I'd like to hand over to Ishan to elaborate on the role of education in health.
Malcolm X once said, "Education is the passport to the future, for tomorrow belongs to those who prepare for it today." Hence, in India, integrating health education into school curriculum is imperative, and it should involve covering topics like nutrition, hygiene, mental health, and substance abuse. It must focus on evidence based information, skill development, and practical application. Collaborations with health professionals and promoting a healthy school environment are key, ensuring students gain essential knowledge for lifelong well being. Next, let's take a look at the integration of AI. It can enhance efficiency, accessibility, and quality of healthcare in India. Other key features include AI powered tools supporting diagnosis, especially in remote areas lacking specialists, through AI powered chatbots that can provide basic medical advice and patient education. It can streamline electronic health records, EHRs, making patient information easily accessible and secure. Artificial intelligence can analyze large data sets to detect disease outbreaks early and monitor population health trends. AI algorithm can analyze genetic and clinical data to tailor treatment plans for individual patients. AI can accelerate drug discovery processes by predicting drug efficacy and safety based on molecular data. It can optimize health operations such as bed management, resource allocation, and staff scheduling. Implementing AI in the Indian healthcare system requires collaborations among healthcare providers, technology developers, policymakers, and the public to ensure effective and ethical deployment, ultimately improving healthcare access and outcomes nationwide. Now, let's take a look at what the need for ensuring quality healthcare. Quality healthcare is much needed for a country like India because low quality can lead to the patient spending more on further treatment. The patient tend to be left off worse than when he came to the hospital. For this, we need well-trained staff, personalized but equitable execution of treatment plans, and increased scrutiny on resource allocation so that there is no scope for corruption. This is particularly necessary because 15% of deaths in low and middle income countries are caused by poor quality healthcare. While ensuring quality, we must remember that quality is not a given. It takes vision, planning, investment, compassion, meticulous execution, and rigorous monitoring from the national level to the smallest, remotest clinic. Now, let me invite Gopika to further indulge on what we can do to help the healthcare sector.
Knowing is not enough. We must apply. Being willing is not enough. We must do. To contribute to ensuring good health and supporting the Sustainable Development Goal 3, SDG 3, which focuses on ensuring healthy lives and promoting well-being for all at all ages, here are several actions individuals and communities can take. Educate yourself and others about health issues such as vaccination, sanitation, hygiene practices, and nutrition. Advocate for policies and practice services for everyone without financial hardship. Encourage and practice healthy behaviors such as balanced nutrition, regular physical activity, adequate sleep, and stress management. These habits can slightly reduce the risk of non communicable diseases. Promote mental well being by reducing stigma around mental health issues and advocating for access to mental health services. Support initiatives that aim to improve air and water quality, reduce exposure to hazardous chemicals, and mitigate climate change impacts, as these factors greatly influence public health. Participate in or support community based health programs, volunteering your time or resources to initiatives such as health screenings, vaccination drives, or health education workshops. Now, I invite Ishan to conclude this seminar.
The main aim of our seminar is to create awareness regarding how we can improve the system and what we are doing right and what we are doing wrong. According to the Sustainable Developmental Goals Report 2024, with just 6 years remaining, current progress rates fall far short of what are needed to meet the SDGs. The lingering impact of COVID-19 pandemic, geopolitical tensions, and growing climate chaos have severely hindered progress. More than half of the world's population is not yet covered by essential health services. Hence, as a global citizen, we must remember that inaction breeds doubt and fear. Action breeds confidence and courage. If you want to conquer fear, do not just sit at home and think about it. Go out and get busy. Because healthcare is not just for the few, the elite, or the affluent. It is for everyone. Thank you.